Hi everyone, my name is Jasmine. I'm a fourth year medical student, and this is a presentation on how to be successful during your EM clerkship. I'm also working with another person. Her name is Jessica. She's also a fourth year medical student. Before this presentation, we would really like you to fill out this pre-survey questionnaire. This will be really helpful. We are Veritas Leadership. We're MIMS this year, and this is for our project. So scan this QR code and take some time to fill out this survey. I'm just going to continue. So these are the objectives of this presentation. This presentation is really for y'all to know what are some of the things that you can do during your first shift, how to be a great EM student. We'll go over where to go for your first shift, what to do, how to create a great differential diagnosis. We'll also be giving you some good resources for your end of clerkship shelf. And yeah, so this is the map of the emergency department. I think the best way to do this is start from the A elevators. Hopefully by now y'all know how to get to the A elevators in the sky lobby. You want to take those A elevators to the ground floor. And then from the ground floor, I think the best way to do this is not go through the waiting room, but go through the back end of the emergency department. So from the A elevators, you want to take a right, hit a dead end, and take another right. Once you pass the first and the second hallway, you can take these doors to get to the mid-track. You only go through one set of doors to hit the mid-track. You'll go through some patient rooms, but this is where the main physicians sit at. To get to the main ED, where it's also called as Pod 2, you want to go through about 1, 2, 3 set of hallways, and you want to take another right, go past 2 double doors, and then you'll get to the Pod 2 area. And this is where all the physicians sit for the adult side of the ED. To get to the med recess, you want to go basically all the way down to the hallway until you hit the trauma side, and you want to go down 2 sets of double doors again, and you'll hit med recess. And then once you know where adult ED is, Pod 2 is, getting to the PD ED is really easy. You just go straight down and you'll hit PD ED. So here are a few things that you can do for every shift. So when you first enter any shift, I think it's good practice to introduce yourself to everyone. A thing that you have to be aware of is that when you come in an hour before people actually sign out. And so when you come in, they're in the middle of sign out. So you want to wait until they're done before you introduce themselves, or figure out who's coming on for the shift that you're going to be a part of, and introduce yourself to them. Other easy things that you can do is log on to Epic and then pull out the track board for the emergency department on Epic. After the sign out process happens, make sure you talk to your upper levels and attendings and tell them who you are and what are some goals you have for the shift. Having that communication prior really helps them and helps you know what you can do and what they are willing to let you do during a shift. Also, you want to talk to your other fellow students on the shift. You're going to have other medical students. You may have sub-Is also on your shift. So you want to figure out what is the process of how you want to pick up patients. You definitely can go into a room with other medical students, but you want to try to get to the point where you can go to a room by yourself and take a full history without anyone else there. So what are some things to do and not to do on a shift? So do's, like I said, introduce yourself whenever you come on. Also, get all the mandatory paperwork done early so you don't have to worry about Epic access or other stuff. Be proactive. I think this is number one. When it comes to a shift in the emergency department, you really can make it out. You can really make out the shift any way that you want to, but I think the best way to get the most out of a shift is to be proactive. So watch track board, listen overhead when patients are being announced. the best way to pick up a patient is being aware. And what I mean by that is whenever a new patient comes in, it's always announced overhead. There's always an announcement, oh, EMS to room 20 or new patient to room 20. There is an announcement that tells you when there's a new patient who comes in. And you want to be there. At times, the residents or the attendings are too busy to even go see the patients when they first come in. So you can be super helpful during the situation because you can get that report and report that report back to your attendings or your residents. And then look up things you don't know. You guys are still learning. Allow yourself to have time to look up things. It's okay to take a patient history, and then take a few minutes to search online, like, oh, what are some tests that you want to do, or what do you think it might be? Like, make sure you take some time to look those things up. Here are some things you don't want to do. You don't want to present on a patient and then totally forget about them. Make sure you're keeping up with your patients. If you ordered some labs or ordered some imaging, you want to go back and check on Epic for if those labs or images have been resulted. You also want to go back into the room and ask how they're doing. Sometimes we give them pain medications or we're doing some sort of intervention. You want to make sure whatever you're doing is actually helping the patient. So go back to the patient and check up on them. You also don't want to just see one patient and do nothing and study for the rest of the time. Take advantage of this clerkship. Literally, the best way to take advantage of this clerkship is to be active and be present. Don't wear headphones. Don't be late to your shift. I always try to be at least 10 to 15 minutes early on a shift, so I can see like, oh, here are the residents that are coming in. And then here are the residents who are already here when I was here. They're probably leaving. Don't be nervous. Everyone is super nice in the emergency department. They're wanting to teach you. They're there to teach you. And this might not be as prevalent now, later on in the season, I guess. Don't ask for interns for help or like too much help. They're actually really helpful. They know what you're going through. They've been there where I guess they're the most recent to like being med students. I think this really doesn't apply as much now. I think definitely use interns as your resource because they will be helpful. But I think what comes from this is like just being aware of your surroundings. Figure out like if they're busy or if they're doing something, maybe that's not the best time to ask a question. If they're in like a conversation or they look like they're overwhelmed. And it doesn't just apply to interns, it applies to every single person on the team. Like if you see someone like working and like being overwhelmed with something, probably not the best person to ask. Here are some few tips on how to be helpful. I've already talked about a few of them. I think number one bullet point is be there when there's a new ambulance when they come in to get that sign out. Anytime a new patient comes into the emergency department, you'll have an overhead announcement telling you where they're going and how they're coming in. During a med recess, there's a lot of things you can do in this situation. Things can get really hectic during these times, and you want to make sure that you're helpful but also not in the way. So before a patient comes in, there's a few things that you can do. Usually you have time to like set up. On the overhead announcements, they'll tell you like, oh, med recess, patient coming in to med recess 3 in like 5 minutes. Sometimes it's immediate, but usually you have time to set up. So during this time, you want to help by grabbing some gowns, grabbing some sheets. You can help set up suction if that's what the patient requires. You can also have an ultrasound ready, and that can be really helpful in a stressful situation. On arrival, when the patient comes in, you can help them transfer the patient to the bed. You can also help by removing the clothing. You want to make sure you have some trauma shears to help cut clothing off. Another thing you can do to be helpful is pay attention to procedures, and don't be afraid to ask to be involved. So if it's your first time doing a procedure, pay attention. Pay attention how it's done. What are the supply items that you need? Where are the supply items located? Because sometimes it's like really difficult to find those items and they're in like odd supply closets. And next time, whenever the same procedure comes in, you can be ready and help your resident. You can be ready and help by having those supplies ready for your resident. And then more than likely, you'll be able to do that procedure as well if the resident knows that you've seen one and you're confident enough to perform one on the patient. Another way to be helpful is by calling consults. This can be really helpful, especially when it's really busy in the emergency department. If there's a patient needing to be admitted, usually you want to call the person you're admitting to. And so, number one thing I think when it comes to calling consults is you want to tell them why you're calling them. For instance, like if a patient's coming in for abdominal pain, and it's clearly cholelithiasis, they're requiring a lab chole, an emergent lab chole, let's say. You want to tell whoever you're calling, oh, we're admitting this patient to surgery for an emergent lab chole. And then you can go into like the presentation, like, oh, when did it start? When did the abdominal pain start? La-di-la-di-la. So you can go into those details later, but you want to tell them the why first. Now I'm going to talk about how to give a good EM presentation. EM presentations can be a little stressful in the beginning because it's a different way of giving a presentation. It is a way, usually when you're giving an EM presentation, it's a lot more direct and more specific to the chief complaint the patient is presenting. It's usually shorter than any presentations y'all probably have been exposed to. For instance, it's not going to be as long as an IM presentation, nowhere close to that. And so here's like a good structure of like how you can structure your EM presentation. First, you want to start off with a summary statement. You want to say, hey, this is a 51-year-old male or female with a past medical history of whatever medical history they have. Again, pertinent medical history. And then what they're coming in for. Next, you want to go into the HPI, make sure you do your old cards for the chief complaint or whatever symptoms they're presenting with. And then you want to go into the pertinent ROS. And this will come with time to know what is pertinent and what's not pertinent. For instance, if someone's coming with abdominal pain, and you ask them, oh, do you have any vision changes or hearing loss? And they say no, you do not have to present that to the attending or the resident. If they are having that, yes, for sure, present it. But if they're not having something that's not related to the abdominal pain specifically, you don't have to mention it. And this is important for the opposite as well. Pertinent positives for something like abdominal pain, making sure that you're asking certain questions involving abdominal pain is important. For instance, like you want to ask if they're having any nausea or vomiting, if they're having any stool changes, if they're having diarrhea or constipation, if they've had a bowel movement. If it's female, you want to ask them if they're sexually active or like have a chance of being pregnant. So you want to ask those questions to the patients. Next, make sure you talk about their vital signs. This is important. I always forgot as a medical student, as a third-year medical student, and even as a fourth-year medical student to even look at vital signs, but these can be really helpful. This can be really helpful, especially telling you if the patient is stable or unstable. Next, you want to go through your physical exam. Again, pertinent positives and pertinent negatives. Making sure if it's an abdominal pain patient, making sure you do the abdominal exam. And yeah, next you want to, so next part of the presentation. If you've done the first 5 of these, you have done an amazing job as a third-year medical student. The next few steps are like a step forward. Things that can do that will like put you above and beyond. So the next thing you want to talk about is what are some differential diagnoses? What is the most dangerous? What is the most likely differential diagnosis? Making sure you talk about all of them, because that's our job as EM physicians, is to rule out the most dangerous thing and make sure that whatever they're having is not emergent. Then you want to talk about your plan. And your plan has about 3 things. Number 1 in your plan, or like in no particular order, test to order based on your differential diagnosis. So for abdominal exam, would you want to get imaging? What labs you want to get? If it's a female, would you want to get a pregnancy test? Like, what labs are you wanting to get? Next is treatment plan. You want to treat your patient's pain and nausea. Do not forget this. A patient's coming into the emergency department because they're anxious, they're hurting, there's something. You want to treat the patient's pain. And this is like number 1. And then this is plus minus. You want to think about disposition. Where do you think this patient will end up? Do you think they'll end up going back home with like some pain medications? Do you think they'll be needing to be observed for a little bit and then discharged? Or do you think they need to be admitted? So this is something that you should think about and definitely talk about with your resident or attending whenever you're giving a presentation. Here's another template of a patient presentation. Basically, similar things that we talked about in a better and prettier format. We will have these slides available for y'all. I'll put my email address and Jessica's email address at the end of the presentation. So if you would like a copy of this presentation or wanting to ask us any other questions, please feel free to do that. Dr. Kondo will also have this presentation, and so if you want this presentation, just contact any of us. Here are some templates also available as well. These can be helpful prior to going into the patient's room, and a really good way to like how to format your presentation. Here's an example of a presentation. I believe there was a good video example that this guide had. Here is a written out example of a presentation. I'm not going to go through this fully, but things to note out of this presentation is here is the summary statement, here is the HPI, here are some pertinent positive and negatives for ROS. Next are the vital signs, and then physical exam. And then we're going to talk about how to create a good differential diagnosis. So creating a differential diagnosis comes with time and practice. It is a lot different in an EM setting because you are seeing this patient for the first time. And so you really have to think about everything that could be possibly going on with this patient, especially anything that you might think is emergent for the patient. There are many ways of going about this. My partner Jessica, she really likes this Vindicate acronym, and we'll go through this acronym fully in the next slides. I personally like having the way that I do it is having a list of differential diagnoses for each main chief complaint. So for abdominal pain, I'll have a list of differential diagnoses already on my list. So for me, like whenever someone's coming with abdominal pain, I'm always considering the emergent cases. I'm considering perforation, I'm considering infection. Could it be constipation, or could it be that, constipation, they haven't pooped in a while, some sort of like inflammation process in the stomach, are they pregnant? You also want to include like pelvic conditions as well, because it's all in the same area. You want to consider pregnancy for women, ectopic pregnancies. You want to consider torsion, both ovarian torsion and testicular torsion, depending on the gender. And yeah, so I make sure to have like a list of things for each chief complaint. A more organized way, I guess, would be using this acronym system. So this is an extended version of the Vindicate acronym or mnemonic. V stands for vascular. You always want to have MI on your list. That's why whenever a patient comes in to the emergency department, more than likely they'll have an EKG done. You want to think of infectious or inflammatory processes. You want to consider neoplasm. D stands for degenerative. I stands for intoxication or iatrogenic. C stands for congenital. A stands for autoimmune, allergic, or anatomical. T stands for trauma or toxins. E stands for endocrine, environment, electrolytes, or metabolic. And S stands for something else or psych related. And this category is usually a diagnosis of exclusion. So here's an example of using the Vindicates method for abdominal pain. I'll let you all read through this on your own time, but this is one way of creating a good differential diagnosis that you don't miss anything. And then disclaimer, this is a very broad example. You do not go through these for your presentation, but this is definitely something that should be going through your mind while you're getting the information from the patient. And then it's up to you to narrow it down to what's most dangerous, what's going to kill them and the fastest, and what is most likely. Here's some helpful resources that you can use during your EM clerkship. We group them up into two sections, what's helpful in EM and what's helpful in all clerkship. Things that were really helpful during my EM clerkship, number one being the EM clerkship podcast. I listened to this on my drive to my shifts and on my drive back. These were really helpful, especially they had about 11 episodes on the shelf and preparing for the shelf, and that was really helpful. They also have an Anki deck that's associated with the EM clerkship podcast. Another app that's really helpful is the Suture app. This tells you what type of sutures to use, what size to use, depending on where it's located, and what type of laceration it is. The Wiki EM app, I personally have not used this, but I heard it's really good. And if you're really interested in EM, I would recommend joining EMRA. It's not that expensive, and you get really, really nice and cool books. For instance, there's a really good antibiotic guide that has been really helpful whenever someone comes in for an infectious cause. What's helpful in all clerkships? I'm sure y'all have used UWorld and Anki for your clerkships. It's helpful for EM as well. MedCalc is really helpful for risk stratification tools, especially for EM. You'll see for certain things, such as like imaging or labs, we really like to risk stratify someone and figure out if the patient even needs that test in the first place. And you get a collection of those tools while you're on the clerkship. And so pay attention to what stratification tools are being used for each patient and add that to your MedCalc. First aid, y'all get a book. Y'all get the first aid EM book through the clerkship. This one was really helpful for things that I had gaps in. For instance, for me, like cardiac was a topic that was really difficult for me, and so I used the first aid book to fill in those gaps. And online Med is really good. If you're a visual learner, this is really good. These are videos on different topics, and this is helpful for all clerkships. So how do you approach EM questions on the shelf? EM questions are a little different. They're They're very similar. If you all have done surgery, your surgery clerkship, they're pretty similar to surgical questions. But a few tips that I have is you want to first determine when you're reading the question stem if the patient is stable or unstable. And you can really base this off of vital signs and the physical exam that they're having. Look at their vital signs, if they're hypotensive, if they're tachycardic, they're not breathing well, their oxygen stats low, you know they're unstable. Next, you want to look at ABCs. You want to see if any of those are compromised. If airway is compromised, you want to intubate. If breathing is compromised, like they have decreased breath sounds on one side, you want to do something to help out with that, whether it be a chest tube or a needle decompression. And then C stands for circulation. You want to look at the BP and pulse. And if that's low, if BP is low or they're tachycardic, you want to give some sort of fluids. For this, you want to know why is there, if it is compromised, if the C is compromised, you want to know why it's low. So like if their blood pressure is low, is it because it's a trauma? They're having blood loss, you want to replenish anything that's being lost. So if they're having blood loss, you want to give them blood products. If they're hypotensive because they're septic, you want to give them fluids. And then know the big chief complaints and can't misses for each. You want to know chest pain. You want to know what can't you miss for sure for chest pain. You want to know abdominal pain. You want to know back pain. You want to know headaches. Ultramental status, intoxications, and you want to know like what are the things that you cannot miss for sure for each one of these. And trust me, by knowing this, it really does help what to do for the next step questions. You're going to get a lot of questions that will ask you, what is the next step for this patient? And it's usually based off on what the patient is presenting with. So for anyone coming in with chest pain, you get an EKG, chest x-ray, echo, trope. Anyone who comes in with this chest pain will get these 4 things, no matter what. And so yeah, that's the end of our presentation. Before you all leave, we would really like you to fill out this post-survey questionnaire. And I really hope this was helpful for y'all. Thank you so much. One last thing, here is our contact information. If you have any questions regarding the clerkship, regarding a future in EM, any questions at all, we will be available for y'all. Wanting more resources, things that we did during our clerkship and during our sub-Is, anything y'all need, you guys can contact us.